Signs and symptoms of potassium deficiency. A Betta-Health presentation, where health and fitness matters. So sit back, relax and enjoy. The mineral potassium plays a very important part in maintaining optimal fluid and electrolyte balance in your body. Potassium also regulates muscle contractions and maintains healthy nerve function. Studies show that, to a large extent, the American diet is well below the recommended intake. This diet favors processed foods over fruits, vegetables, beans and nuts. Notwithstanding, a low potassium diet is hardly ever the cause of potassium deficiency or hypokalemia. Rather, it happens when your body suddenly loses a lot of fluid. The main causes include chronic vomiting, diarrhea, excessive sweating and blood loss. Potassium deficiency is characterized by a blood potassium level below 3.5 millimole per liter mmol. But before we dive in, take a moment to like, share, comment and subscribe to my channel, so you will never miss my videos. What's more, I have a few products in the description and comments section. They are potassium supplements and highly rated exercise equipment. So check out these products to perhaps try them out. Without further ado, we continue. Here are 8 signs and symptoms of potassium deficiency. 1. Weakness and fatigue. These are often the first signs of potassium deficiency. There are several ways that this mineral deficiency can cause weakness and fatigue. First, potassium helps regulate muscle contractions. When blood potassium levels are low, your muscles produce weaker contractions. Deficiency in this mineral may also affect how your body uses nutrients, resulting in fatigue. For example, some evidence shows that a deficiency could impair insulin production, resulting in high blood sugar levels. 2. Muscle cramps and spasms. These cramps are sudden, uncontrolled contractions of the muscles. This happens when potassium levels are low in the blood. In the muscle cells, potassium helps relay signals from the brain that stimulate contractions. Potassium also helps end these contractions by moving out of the muscle cells. So if blood potassium levels are low, your brain cannot relay these signals as effectively. This results in more prolonged contractions, such as muscle cramps. 3. Digestive problems. Problems with digestion have many causes, one of which may be potassium deficiency. It helps relay signals from the brain to muscles located in the digestive system. The signals then stimulate contractions that help the digestive system churn and propel food so it can be digested. Therefore, if blood potassium levels are low, the brain cannot relay signals as effectively. So contractions in the digestive system may become weaker, slowing the movement of food. This may cause digestive problems like bloating and constipation. 4. Heart palpitations. Have you ever become aware of your heart suddenly beating harder, faster or skipping a beat? This feeling is known as a heart palpitation, and is commonly linked to stress or anxiety. But heart palpitations can also be a sign of potassium deficiency. This is because the flow of potassium in and out of heart cells helps regulate your heartbeat. Decreased levels of blood potassium can alter this flow, resulting in heart palpitations. 5. Muscle aches and stiffness. Muscle aches and stiffness can also be a sign of a severe potassium deficiency. These symptoms may indicate rapid muscle breakdown, also known as rhabdomyolysis. Normal blood levels of potassium help regulate blood flow to your muscles. If the levels are severely low, your blood vessels can contract and restrict blood flow to your muscles. Consequently, muscle cells receive less oxygen, which may cause them to rupture and leak, resulting in rhabdomyolysis, which is accompanied by symptoms like muscle stiffness and aches. 6. Tingling and numbness. Potassium-deficient persons may experience persistent tingles and numbness. This is known as paresthesia, and usually occurs in the hands, arms, legs and feet. It is important for healthy nerve function. Decreased blood levels of potassium can weaken nerve signals, which may result in tingling and numbness. Sometimes these symptoms are harmless, but persistent tingles and numbness may be a sign of an underlying condition. If you experience persistent paresthesia, it's best to see your doctor. 7. Breathing difficulties. Severe potassium deficiency may lead to breathing difficulties, as potassium helps relay signals that stimulate the lungs to contract and expand. With extremely low potassium levels, your lungs may not expand and contract properly. This results in shortness of breath. Further, low blood potassium can make you short of breath, as it can cause the heart to beat abnormally. This means less blood is pumped from your heart to the rest of your body. 8. Mood changes. Deficiency in potassium has also been linked to mood changes and mental fatigue. Low blood potassium levels may disrupt the signals that help maintain optimal brain function. For example, a study found that 20% of patients with mental disorders had a potassium deficiency. However, there is limited evidence in the area of potassium deficiencies and mood. More research is needed before making any recommendations. Here is a list of foods that are great sources of potassium, along with the percentage of the reference daily intake, RDI, found in a 100-gram serving. 1. Beet greens, cooked, 26% of the RDI. 2. Yams, baked, 19% of the RDI. 3. White beans, cooked, 18% of the RDI. 4. Clams, cooked, 18% of the RDI. 5. White potatoes, baked, 16% of the RDI. 6. Sweet potatoes, baked, 14% of the RDI. 7. Avocado, 14% of the RDI. 8. Pinto beans, cooked, 12% of the RDI. 9. Bananas, 10% of the RDI. In the U.S., food authorities limit potassium in over-the-counter supplements to just 99 milligrams. In comparison, a medium banana contains 422 milligrams of potassium. This limit is likely low because studies have shown that high-dose potassium supplements may damage the gut or lead to an abnormal heartbeat. Taking too much potassium can cause excess amounts of it to build up in the blood, a condition known as hyperkalemia. Hyperkalemia may cause arrhythmia, or an irregular heartbeat, which can cause serious heart conditions. However, it's okay to take a higher dose potassium supplement if your doctor prescribes it. The bottom line: most people do not meet the recommended potassium intake. But a low potassium intake is rarely the cause of deficiency. Potassium deficiency usually occurs when your body loses a lot of fluid. The signs and symptoms of potassium deficiency include weakness and fatigue, muscle cramps, muscle aches and stiffness, tingles and numbness, heart palpitations, breathing difficulties, digestive symptoms and mood changes. If for any reason you feel deficient, always consult your doctor or a health professional, as potassium deficiency can have serious health consequences. Luckily, you can increase your blood potassium levels by simply consuming more potassium-rich foods, like beet greens, yams, white beans, clams, white potatoes, sweet potatoes, avocado, pinto beans and bananas. We have come to the end. Thank you for watching. But before you go, please remember to check out the products in the description. I hope you do.